Hi, it's Ashley here. This is part 2 of my Medical Director tutorial. If you missed the first part, I'll link to it up here where we go through the initial setup of Medical Director. But now let's jump into a patient's file. Okay, so there's a few ways you can open a patient's file. From here you can click patient at the top and open. Or you can hit F2. If you're in the Praxsoft waiting room here, you can click on the Medical Director icon and that will open up the selected patient. And if you're in the appointment book, you can right click on a patient's name and open in MD. So we can open that up and it should go, but it doesn't. Look at that. Bit of a failure again, Medical Director, you're killing me. So then you're going back here to open. We'll open one of the many test patients that I've accumulated over the 20 years. So yeah, prompts, you can ignore those usually. Okay, so this is what it looks like obviously when you come into a patient's file. Quick rundown, there's a few tabs across the top of the window here. We've started in the medications list. We've got the patient demographics in the middle here. And you've got a few buttons across the top here. Basically the pictures of the icons try and show you what it's supposed to be. So the plain is travel advice, don't know what that is, learning. But some of these are contextual depending on what window or what tab you've got open here. So the action of the plus and minus button and the print button changes depending on what tab you've got open. For example, the medications, whichever item you've got listed to print, then makes sense that the print button will print those items out, and the plus button adds a medication or a prescription, and you can sort of type in there what you would like. In progress notes, so printing would print out the highlighted progress note on over here. The plus lets you add in a shortcut. So the progress notes are pretty self-explanatory. Got pass history again, pretty straightforward here. You've got your results tab, which has the investigations, usually pathology and radiology. Letters or documents generated from yourself. So any referrals, medical certificates, reports, they would come up in this tab here. Documents is generally what you receive in or scanned in, depending on what your process is in the practice. Old scripts is old prescriptions which have been printed out. Immunisations is pretty self-explanatory. The plus sign lets you add a new immunisation that you've administered. Correspondence is a tab which you can switch off, but it basically accumulates everything in the letters, results and documents tabs all into one. Before the patient comes in, I've opened the file and we try and figure out why the patient has come in. Usually you can get that from the progress notes by seeing what they came in for last. So that's where I usually go first and see what they've come for before. Looks like mostly just training for the admin staff here. You can also have a look at the prescriptions, so if anything's due or running out soon, that might give you an idea. Most of the time you can guess why the patient has come in a rough way. The summary tab, I don't use a whole lot, but it can be useful, especially if this is a patient you haven't met before. So it gives you a bit of past medical history and medication, so forth there. Depending on the patient, I also flick through just the documents tab just to see if they've been at a hospital or I've seen any specialists for any updates that might have come through that I've forgotten about. Okay, so we get the patient in and we can start off with the history. So in terms of documenting their history, I tend to free type all of that. There's a history button here. Do not know how to use this really, so I don't. I usually set up my notes in a SOAP method, so subjective, objective, assessment and plan. Medical Director doesn't follow those words specifically, but you can get something pretty close. So for subjective, Medical Director will list that as history, so the shortcut I use is HX, which I think is universal, and that will give you the history title. So usually free text for history, both. Okay, so that can be a typical history of presenting complaint. Not really related to Medical Director, but just in terms of workflow, I generally ask after that first sentence or two if there's anything else on their list, just so you can figure out how you're going to organise your consult. So once you've done your history, the next step is examination, and for Medical Director that's on examination, which is OEs, and if you tap space or enter afterwards, it'll pre-fill that for you. Again, for most of this stuff, I do free type. There's a few things which are worth coding. Basically, that's things like your blood pressure and height and weight. Otherwise, I don't see much function in the examination button down here. So even things like temperature I would free type, because I don't feel like it's worth tracking that over a long time frame, maybe over 1 or 2 consults tops. So blood pressure, there is a shortcut which is Control-Alt-B, but I tend to just click the mouse up here and then enter the blood pressure here. You can either press tab to get across to the next space, or you can push the dash key. One thing I missed from, I think it was ZMed or MedTech, is that you can free type the blood pressure into the notes and it'll automatically code that for you. But same for weight. I mean, you could do it in the same window there, which is up the top here, so you can skip from blood pressure to weight and do the same sort of thing. So when you click save, it won't close unless you set that up, and you can click close there. So once you've done all the examination, then you can go onto your impression or assessment. I usually try and use reason for contact for this, which is Control-Shift-R on the keyboard, and try and pick from a coded problem. So this would be maybe pain, and you can select a whole heap of different things, but we'll just keep it simple with pain. And you'll see you're down here, you can save in past medical history if it's going to be something chronic or significant like that, and then you've got the option to put into summary. So by default, as we ticked, it's not going to save in there, so now we can just click OK, and we've got the reason for contact there. Next up, I'll go with management. Interesting to note, if you put the management in first, the reason for contact will always be entered above management, which is handy, so you don't always have to do that reason for contact before you type in your management plan. So management, again, I'd free type this, so simple analgesia maybe. And a lot of this stuff you can set up in as a shortcut in comments. Add to list here, making sure that it's something unique and something that people won't really type. So please don't put something like STI going into soft tissue injury, because obviously it can mean different things to different people. I usually find putting a number or a symbol into it will make it less likely for others to incorrectly use it. So after this is sort of winding up the consult now. You've got your management plan, you put your reason for contact in, and the last step is probably Medicare item numbers, which the shortcut I use is Control-Shift-M, or you can use the buttons down here. So the default is item number 23, so Alt-I and to add that item number, and click S to save it. Cool, and that's basically a quick run through of a patient's consult. I'll go through what it looks like seeing a new patient, because taking initial history is a little bit different from seeing a regular patient for review. There's a few other areas where you need to add information. If we want to open up a new patient's file, we can hit F2, which will open the search patient box. So let's look for our new patient. And there we go. So your new patient's pretty much a blank slate. You might get the reception staff to fill in things like the occupation and things like that. So again, the process is pretty similar. So on progress notes, so you start off with your history and go from there. If you're going through accreditation, they do go through your software to look for specific things, important things in the history. So things like your allergies, smoking history, and medication history, to see if they're up to date. So if you don't tick them in the right ways, then it's not going to show up in your stats. So allergies and adverse reactions, if you double click into this area in the box, and if they don't have any allergies, obviously tick this box. If they have allergies, you can add them through this section here. Just while we're on this window, the warning sign you can use for just simple reminders. I usually use it to put in the names of someone's partner or parents if they're kids. Often they'll come together and it's a bit of a reminder of what their names are. So if we go along the tabs here, so again in the initial history, you're usually going to take something like a family history. I think it's useful to put in here into this area, and along with social history and occupation too. The reason for using these boxes here is that sometimes if you're printing out summaries, then they'll auto-fill that family history and social history for you. Notes here just for any other miscellaneous information that you want to list, which is easily accessible. Smoking tab, so as I said, with accreditation it's important to have something ticked here, and this is where you do it. So in the smoking drop down, you tick which one's applicable here. Alcohol history as well, you can go through the tick boxes too. And that's about it for this area here. Okay, so you filled out that information. I guess you want to update their medications. If they're not on any medications, something I've recently found is that you can tick not taking any medications down here at the bottom, and that will update on the software that you've checked their medication list. Just a few other areas where you can find information. So there's the obstetric tab here, so if someone's pregnant you can enter a pregnancy here to track it a bit easier, and it will automatically come up in the warnings as well. So if we put a new pregnancy here, you can save that. And yes, we'll go 28 and save there. So, and that'll come up here, and in the warnings it'll have a nice reminder that the patient is pregnant. Similarly, when they've ended the pregnancy, you can end pregnancy here. The cervical screening results will only come into this tab if you enter it either from the holding bay or your results, and I'll show you quickly how to do that now. Let me just find a result for you. Okay, so here we're in the holding bay with the results, but if we right click here and copy to record cervical screening result, so from here then you can click add, and that will put it into the cervical screening tab, which makes it a little bit easier to track when the last test was, and you can also add the recall for 5 years or whatever it might be. So we'll go back to the patient's file. Zoom. Just other small common things. A lot of people need medical certificates. 2 ways of doing it. If you've set up the shortcut, it's down the bottom here called medical certificate. You can click that and it'll take you directly to the letter writer, which is essentially Microsoft Word 95 built into Medical Director. The other way to get into the letter writer is either with the shortcut F8, or this little button here, which is someone writing on a piece of paper, which is the letter writer there. So you can click that and it'll take you to a blank document. So things like referrals, this is where you would go for this. So new, file new, or you can click the new button here, or you can go Control N. So there's a lot of different ways to do the same thing. So if you need to jump from the letter writer to the medical notes, so if you need to refer back to, say, an old progress note or document when you're writing a referral, the way to do that is to go window up here and then go into your patient's file here, and you flick between the windows that are open. Ordering pathology and radiology is pretty straightforward as well. Pathology request up here, and you've got the radiology up here. Cytology request. You can do cytology requesting. I obviously don't do enough of these to know if this setting is going to be useful or not. Where were we? So we're going to order pathology, which is here. So you can set up your default provider here. Again, you've got your favorite set up at the top here. You can click which ones you want to add on there, and you can also free type, which is what you might do a lot of the time as well. Here. So the clinical details, again, there's presets here. I just find it easier to free type. And then you click print and it will give you a pop-up if you've selected it. So similar process for radiology. So click the X-ray, chest X-ray button up here. This one doesn't have a default set for me. I don't usually use these radio buttons to order tests. I would usually free type up the top here, and then free type the clinical details as well. The only thing we haven't done much of yet, I guess, is prescribing, which is back on the medications tab. So as we looked at before, if you click the plus sign, you can add a medication. So if we stick with perindopril again, so we can start with a 4 milligram tablet. You can either double click or click prescribe down the bottom here, and let's get going. Well, it is pregnancy category D. We will risk it. So here you can enter the dose and frequency. This one's 1 a day. So if this is a medication that you're going to use frequently, you can set the default on here by clicking the bottom here, so then it'll be pre-filled every time. Duration is automatically set to limited. So something like this you can either change to long-term later, or you can tick it from here. The thing it'll change is what comes next, is that it'll automatically go to maximum repeats. With the limited option, it will ask you to specify how many repeats and the quantity that you need. So enter reason for medication, so we'll go with hypertension, and again it doesn't automatically save in past medical history or reason for contact, and you can tick that if you like here, if it is something that's going to be a chronic medical condition or something worth putting in the past medical history. So let's go OK. It'll automatically ask you to if you need to add any other medications, but you can just close that. Yeah, and it'll pre-fill all of that stuff into your notes, so it makes it look a little bit more impressive, really. Yeah, so that's a pretty brief summary of how I use Medical Director on a day-to-day basis. I think the best way to really become efficient at it is just to keep using it and explore all the menus and the options that you have if you've got time, because there really is a lot that you can do with this software, even if it isn't best practice. If you think I've missed anything, or if you think there's a tip that you find really useful, let me know in the comments. Otherwise, feel free to share this to your new GP registrars or even your new GPs joining your practice for the first time. Yeah, hopefully you've learned a thing or two about Medical Director. If you like this video, then percuss the thumbs up button. If you want to see more videos like this, then palpate the subscribe button. Otherwise, we'll see you next time.